Welcome to Research MD. This is Dr. Pramil. Another presentation. We continue our presentation to what kind of things we should do before you go to the laboratory to get the blood work done. Okay, please watch our videos before. I have said this many times. What happens to a lot of my patients is they go to one lab and they get the results back and they're not very happy, and it's an abnormal. And the first thing they're going to say, this lab is very bad, let me go to the next lab. And they go there, get the results, and come back again. Oh, I don't like this lab either, and all that. Don't be in the situation like that. Watch our videos before you get any kind of blood test done. Today our topic is how, when you have a doctor-ordered thyroid function test, what are the things you should be doing, okay? In the thyroid function, it could be TSH, free T4, free T3, and all of that, a combination. Now, the first question, should I fast before this test? Absolutely, there's no need. There's no need to fast. Eat whatever you want to do the regular way, and prefer morning sample, because thyroid and all the hormones are thyroid is a very important hormone in your body. So it's better to get that done in the morning, okay? So again, the next thing is what time I should take the test. We already said morning before 10 a.m. probably the ideal thing, because TSH level fluctuate throughout the day, and they're pretty good in the morning, the highest, because of the hormone, the cortisol level and all that. So consistency matter. If you're doing it, let's say thyroid function test is TSH. Usually we do every 6 weeks, okay? So every time you do the test, make sure, if it is in the morning one time, always do it in the morning. If you did it in the afternoon, please always do that in the afternoon. So no much fluctuation, okay? Now, what kind of things you should avoid before you go to the lab? Avoid soy-based products, cruciferous vegetables like broccoli, kale, cabbage. That should be avoided because they contain this goitrogens and temporarily suppress the thyroid function, okay? And limit iodine-rich food like seaweed, fish, and dairy. Those are the things you should avoid. Now, the next question, can I smoke before the test? Absolutely not. I would recommend maybe 24 to 48 hours minimum stop all of that, because smoking contains thiocyanate, interfere with the iodine uptake, and your thyroid can cause hypothyroidism or hyperthyroidism, okay? So you will never know what hits you. So don't smoke. Remember, the nicotine contains thiocyanate, and that can affect the iodine uptake. Can I drink alcohol before the test? No. Avoid alcohol, 24 to 48 hours, no alcohol, because it can suppress the thyroid stimulating hormone, leading to low TSH, okay? Now, how long do I have to sleep? Every test I recommend, you should be relaxed, because all these hormones in the body are all interconnected, right? You don't want to go when you're stressed out to go to the lab. Every test you do, make sure like a 7 to 9 hours sleep, get a good night's sleep, and like a normal person, you go to the lab the morning and get the test done. Because sleep deprivation in less than 5 hours can mess up your TSH level, okay? Let's do that. What illness can affect my test? Recent hospitalization, any kind of critical illness, you were admitted for the hospital, take your time. Don't jump in and get this test done. Let's say if you have chronic kidney disease, that can also affect your TSH. If you have cirrhosis of the liver or hepatitis, that can also, these are the common conditions can affect your lab results, okay? Now, what medicines I'm taking could affect the test result? Medication that can increase beta blockers, for blood pressure medicine, for Pramil, metoprolol can affect, lithium for usually we use for depression, amiodarone for cardiac condition that can affect. That's a drug you always have to worry. You have amiodarone and TSH is well known. Steroids also, prednisone can affect it. Iodine supplement or contrast dye. Let's say somebody have given a contrast and ask you to get a CT with the contrast, that will have a lot of impact. So we are saying don't stop this drug. That's the most dangerous thing for you to do. But check with your doctor or get the results. Then hey, I was on this drug. If I don't educate you will not ask. The doctor might be busy. Doctor is seeing a lot of patients daily. A lot of times they don't have the time to go through. They could easily miss like a normal person. Okay, remember that. Now, can I take supplement before the test? No, no, no. Don't do it. Herbal supplement, nobody know what they're going to do. Ashwagandha, ginseng, they can all alter the TSH level. Maybe that's why, when they take some of this drug, that's why maybe they're feeling better. Avoid biotin, vitamin B7, at least 48 hours before testing, because biotin can falsely lower your TSH levels, okay? Now, thank you so much for watching. Again, we really appreciate your support. The most important thing for you to do, any lab, watch our videos and make sure, hey, this is at least you should, and then when you go to the doctor, you can kind of talk about it. We love you all. Please subscribe.